I'm National Investigative Correspondent Angie Moreski. Ethylene oxide is an invisible gas emitted into the air we breathe by facilities around the country, which can pose a cancer risk. Understanding that risk is a major part of the mission for scientists at Johns Hopkins University, who gave Spotlight on America a rare look at their mobile testing lab and the stunning results they found. It comes at a critical time for public health.
So this is our mobile observatory measuring particles and other pollutants, otherwise known as Mom and Pop.
Johns Hopkins engineering professor Peter DiCarlo showed us this lab on wheels being used to investigate toxic ETO gas released into the air in communities across the country.
For ethylene oxide, we saw concentrations of 30 parts per billion.
Which translates to?
Don't breathe that.
The Environmental Protection Agency classified ethylene oxide, or ETO, as a carcinogen nearly a decade ago. Exposure to the colorless gas has been linked to leukemia, lymphoma, and breast cancer. More than 100 facilities across the country use ETO to produce chemicals and sterilize medical equipment and food products, including companies here in Louisiana's so-called Cancer Alley, ground zero for industrial pollution.
We are sick and we are dying.
As part of our years-long reporting on ethylene oxide, Spotlight documented concerns from residents here about high rates of cancer.
We are poor and black in this neighborhood. They figure that no one is going to care, no one is going to look into it.
But DiCarlo and his research partner, Professor Keeve Nachman, did.
This spike reflects when we drove past the facility, we saw the level of ethylene oxide go up.
Taking Mom and Pop to Louisiana.
The estimates don't tell the story, but measurements do.
They found even higher levels of ETO in the air than government models estimated.
The difference was striking.
On average, levels were 10 times higher than what's considered safe for long-term exposure, and concentrations in some samples 3,000 times higher. When you saw the levels that you were getting, what was your reaction?
We were shocked, and we ended up doing another couple laps to make sure that those levels that we saw were real, and they were. We kept seeing those over and over and over again.
One of the things about ethylene oxide that's really important is that it's more dangerous for children to breathe.
Their research comes at a critical time. The EPA finalized new regulations last year to reduce emissions from ETO plants by 90% and require regular testing. But the industry has lobbied against it, citing costs and feasibility. Now, those rules are in limbo after the Trump administration gave facilities the opportunity to seek exemptions earlier this year.
I'm very worried about exemptions. There is a real public health hazard borne by these communities that live near these facilities.
Spotlight on America has been working for months to find out which, if any, ETO facilities have been granted exemptions to the new clean air rules. A closer look at our efforts to get transparency on this issue impacting public health in our next report. For Spotlight on America, I'm Angie Moreski.